Okay, thank you, my viewer. Good morning, everyone. Today I'm going to talk on cervical cancer. What is cervical cancer? Cervical cancer is just the cancer that originates at the lower part of the uterus or that affect the cells of the cervix. That is the definition of the cervical cancer. What are the causes of cervical cancer? Causes of the cervical cancer is human papilloma infection. That is the only cause of cervical cancer. So it is you to detect or to know the definition of it and the cause of cervical cancer, because this is the only cancer that is majorly affecting majority of people. Okay, let us look about the risk factors of cervical cancer. One, we shall look on the human papilloma infection, especially the type 16 and type 18. That is the major risk factors of cervical cancer. Risk factor number two is earlier sexual practices. Maybe you are underage, maybe 16 years and below, and you are doing early sexual practices. You are at risk. Three is having many sexual partners who predisposes you to cervical cancer. Another one, another cause of cervical cancer is just smoking. So it is better to stop smoking for your health. Another risk factors of cervical cancer is called HIV. If you are HIV positive, you are also risk of getting cervical cancer. So it is your responsibility to know that and having regular checkups of which. Another cause is long-term use of birth control pills. That one also can predispose you to cervical cancer. Another cause is low immune system. Maybe you have been affected with HIV, so your immunity is low. You are at the risk of getting cervical cancer. Those are some of the risk factors to cervical cancer. Let us talk about the signs and symptoms of cervical cancer. First is abnormal bleeding during sex, during menstrual period, and after menopause. Another signs and symptoms is unusual vaginal discharge. Maybe you are discharging the white colors, so you should know that. Another signs and symptoms of this is just pelvic pain. You have severe pelvic pain. That is an indication of cervical cancer. How can you treat this? And how can you diagnose this? Diagnosis of cervical cancer is done through HIV testing. You can do HIV testing to know if you have cervical cancer. If it is not HIV testing, you just do pap smear or HPV virus screening, so that you can be able to detect the HPV virus in your body. Another test you can do is called the pap smear. The pap smear. So we have the pap smear. We have HIV testing. You can done it. You can do it. Kuna the HIV screening. You can do it so that you can able to know your status. You can do biopsy, whereby there is a removal of the part of the cervix, so that you go and they check if there is presence of the cancerous cells. That is some signs and symptoms. So practices to make so that you can prevent this cervical cancer. One is children or age 9 to 14 years are eligible for getting HIV or for getting human papilloma, human papilloma immunization. So another one is avoidance of smoking. Another practice that you can do so that you can prevent this is by doing safe sexual practices. and avoid earlier surgical practices. By doing those, and it is advisable if you can be doing human papilloma screening or the pap smear after every 1 year for those who are HIV positive, and after 5 years for those who are HIV negative. It can help you detect if you have cancer. If you have it, then early management start so that it cannot end up into advanced stage. What are some of management of advanced cervical cancer? You can do radiotherapy, unaweza fanya chemotherapy, combined chemotherapy and radiotherapy. You can do immunotherapy at some points. So this one can help you control the cervical cancer. Thank you for watching me. I have appreciated it so much. I love you, everyone. I love everyone. Just not forget to comment, subscribe, share, and like. Thank you so much. God bless you.